Hi, everyone. Welcome to the Vulnerable Vaccination Program industry briefing. We'll get started in a moment. We'll just wait for a couple more people to join us. As you join, please ensure you're on mute, and we'll just wait a couple more moments for a few more people to join. Okay, I think we might get started now. So we have our Vulnerable Vaccination Program industry briefing. And as you join, please ensure you're on mute. And just a quick note that we will be recording the session today, and it will be available on our eProcure website. Thanks, Alison. We have Alison doing our slides here today. So before we get started, I'd like to acknowledge the Wurundjeri peoples of the Kulin Nation, on whose unceded lands our work takes place. We pay our respects to all Aboriginal and Torres Strait Islander cultures, elders past, present and future generations. And MFIN is committed to healing of country and working towards equity and health outcomes and the ongoing journey of reconciliation. MFIN also recognises and values the knowledge and wisdom of people with lived experiences and celebrate their strengths and resilience in facing the challenges associated with recovery. We acknowledge the important contribution people with lived experience make to the development of health and community services in our catchment. Thanks, Alison. So today, our presenters are Anne Gravets, Program Manager in the Primary Care Innovation and Emergency Management team, Laura Murray, Program Officer, Strategy and Service Design, and myself, Acting Strategy and Commissioning Manager, Chronic and Complex Care and Aged Care. And we also have Alison Lee from our procurement team, who's also doing our slides today. Thanks, Alison. A couple of things to note on housekeeping. So please ensure you're on mute and submit all your questions through the Q&A box. So there's a Q&A box down the bottom, and questions will be taken on notice and responded to on eProcure, which is on our MFIN website. And the slides and recording will be available on eProcure. So I'll give you a quick overview of primary health networks before we talk through the program. So primary health networks, or PHNs, were established to improve coordination of care to ensure patients receive the right care in the right place at the right time, and particularly for people who are at risk of poor health outcomes, which are the populations that we're focusing on really for the program. And I'll speak to that more in the next slide. So why Vulnerable People's Vaccination Program? So the program is funded by the government to ensure continued access to COVID-19 vaccinations for vulnerable populations. So the funding model is quite specific with its definition of vulnerable people. And we've given a couple of examples here on this slide. So for example, people experiencing homelessness, non-Medicare card holders, people with disability, First Nations peoples, people from culturally and linguistically diverse backgrounds, homebound individuals, and people living in residential aged care homes and facilities. The list that includes populations is also available on the documentation in eProcure, and it's also much more extensive than this as well. So we did use a range of data from the Australian Immunisation Register, or AIR data, the Australian Bureau of Statistics, Polar data and the Australian Institute of Health and Welfare to understand who the priority populations were across the Eastern Melbourne catchment and by local government areas or LGAs. And we've presented a snapshot of this by LGA on this slide. And this indicates according, if you have a look at this table here, you can see according to the data, Murrindindi, in comparison to other infant LGAs, has a greater proportion of people aged 0 to 64 with a disability, and also has a greater proportion of people who identify as Aboriginal and or Torres Strait Islander, and older adults aged 65 to 74. And also, you can see that Monash has a greater proportion of people who speak a language other than English at home or English as a second language, as well as people experiencing homelessness. So this table gives you a bit of a snapshot as to the priority communities in the infant local government areas. So now I'll hand over to Laura, who's going to talk a bit more about the background of the program design and also more about the program itself.
Thanks,
Laura.
Crystal. Thank you. Many of you may be aware that we ran a grants program last year, and it was called the Proactive Engagement Strategy. And this was a program designed to increase COVID-19 vaccinations in vulnerable groups. And that was by performing polar data searches and then follow-up phone calls to try and encourage vulnerable groups to get vaccinated and plan for winter. This year, the design needed to incorporate service gaps, which included vaccinating homebound individuals and also residents of aged care homes who've been recognised as having barriers to vaccinate all their residents every 6 months in accordance with recommendations from ATAGI. Next slide, please, Alison. Yep. So to design this program, we needed to understand the services and barriers. So we consulted informally with pharmacists and RACH staff, general practice staff and GPs to understand and inform our design. So with the pharmacists, we found they're really well placed to deliver COVID-19 vaccines, especially amongst vulnerable groups who have barriers attending general practices for various reasons, often for the ease and free advice that they offer. However, pharmacists can't offer the flu vaccine off-site. So when we're thinking about developing services for RACH staff, this could have been a bit of a barrier. And they also found that there were barriers with RACHs because of existing contracts. When we spoke to aged care homes, they seem to have themes consistent with the rest of Victoria and Australia, and that was around that administrative burden with consent. And this was also highlighted by different GPs who attend to vaccinate their own patients and having that administrative burden to vaccinate people who weren't their patients. And there was also a bit of a decline from the families because of COVID fatigue. So when we looked and spoke to general practices, they're really well placed and better suited to service homebound individuals due to those complexities that arise. And also a lot of bigger practices are already servicing registered aged care homes, whether they send a GP and nurse or two nurses and an admin staff. Next slide, please, Alison. So what we want to do is we're aiming to establish this GP vaccination hub in each LGA. There'll also be a pharmacy vaccinating hub in each LGA, and the aim is to really increase that access to COVID-19 vaccinations for vulnerable populations and provide that support for vulnerable people to receive COVID vaccinations, including facilitating tailored approaches and develop and implement innovative vaccination activities to assist vulnerable individuals to enable that access to COVID-19 vaccinations in their local areas. Next slide, please, Alison. So I guess for GPs, this is really going to be good for you guys to establish those connections with community health services and other services in the LGAs. You'll be receiving referrals from the local pharmacy hub, which will promote the hub and help identify patients who are not currently affiliated with general practices. And you'll receive referrals from infant for homebound individuals in need of vaccination. And RAFs requiring a connection with a vaccination provider. and also hopefully attract new patients through assertive outreach of these vaccination activities. And these activities will focus efforts and identify and recall and vaccinate vulnerable groups. And I'm going to pass you on to Anne, who will talk about these solutions, what these solutions might include on the next slide. Thanks, Anne.
Thanks, Laura. Before I get to the slide, I just wanted to also mention probably a good thing around the application, which you would have seen when you've downloaded the documents. The specific details of the proposal as relevant to sort of, I guess, the mandatory criteria, so such as practice, public health liability and professional indemnity insurance, cybersecurity insurances, and any conflict of interests are all listed in the RFP. The scope of the services are also defined in the RFP, as is the MFIN's, what we require from a capacity and capability point of view. But in summary, what we see the GP Vaccination Hub to be is about a 6-month program. We're hoping that, once we do our evaluations, select the successful providers, that contracts will be signed as of the 1st of June. It'll be $60,000 per LGA. And the key engagement activities, as mentioned in Laura's points, were around parole data searches, doing some follow-up phone calls of vulnerable groups that you may already be aware of, health promotion, having tailored spaces potentially for people that have specific needs, having referral pathways to service homebound individuals, and also obviously the residents in residential aged care homes. Other examples could be for assertive outreach type scenarios is to work with community health centres, look at homeless shelters or soup kitchens, and even look at the opportunity around some pop-up clinics that might be of value in your LGA of interest. Next slide, please. So this is a bit of a summary slide just around the evaluation criteria that MFIN will look at for all applicants. Obviously mentioning the mandatory criteria prior, the prior slide. Criteria 1 is around giving us a bit of an indication of what, how and why you will be providing the I guess the activity. There is an activity plan template that can be downloaded if you haven't already done so. And what we want to actually understand as part of your proposal is what activities your practice will implement to enable access of vaccination for vulnerable people, why your practice has actually chosen the particular vulnerable group, and how your practice plans to implement these activities. So that's criterion 1. Criterion 2 will look at capability. And for this criterion, respondents must demonstrate their ability to engage people from the identified vulnerable communities by providing examples of potentially past work that has occurred, current activity that you're involved with around vulnerable groups and vaccination. Or even sort of, I guess, things around any sort of research that you may have undertaken around this space. An example of, I guess, activities could be that direct outreach activities that are targeted communities that you've done work in the past, or how you've adapted a existing model to accommodate communities with specific cultural, physical or mental health needs. Criterion 3 is going to be assessed on your ability to deliver, so focus on capacity. And in this response, what we'd like to see is a demonstration of capacity to undertake the work within the proposed time frame. And this includes for your application to provide a resource plan that identifies the staffing involved, including their role and estimated hours allocated to the project, and a timeline on project delivery. And then finally, criterion 4, obviously this is a program that we'd like to see an outcome of sustainability, and the respondent should describe how your practice will build sustainability with vulnerable communities around vaccination after the program has actually ended. Next slide, please, Alison. So just a bit of an overview about the tender application process, and we always like to say as a PHN, just a bit of a reminder, submit as early as you can, don't leave it to the last minute. Obviously noting that the tender closes at 2 p.m. on the 17th of April. It is via e-procure, which is, as Crystal mentioned at the beginning of the presentation, the link is available via the Infant website. Evaluations will of people that have, or practices that have submitted that have met the mandatory criteria will occur between mid-April and mid-May. And notification of successful applicants will occur mid-May, and unsuccessful applications will be around after the 1st of June. We do foresee contracts signed mid-May, and that's our hopefully plan that will hopefully come to fruition with delivery of the program commencing the 1st of June. Next slide. So that's probably the end of our formal presentation. As noted, there is opportunity to submit questions through eProcure. Any questions that have come up through this particular webinar, we will take on notice and provide a response through eProcure. And I guess that's the end of our presentation. Thank you for making the time to come on to the webinar, and hopefully we look forward. We've answered any queries that you may have had, but like I said, any questions, please pop them through eProcure, and we'll get back to you as soon as we can. Thank you, everyone.